Ever wondered why your heart might suddenly start beating too fast, too slow, or irregularly? It's an unsettling feeling, isn't it? Today, we're going to explore a topic that affects millions of people worldwide, yet remains shrouded in mystery for many: cardiac arrhythmias. Arrhythmias, in the simplest of terms, are abnormal heart rhythms. Our heart is a remarkable organ, with each beat controlled by an intricate network of electrical signals. These signals ensure that our heart beats in a coordinated and regular manner, pumping blood throughout our bodies to nourish every cell. But sometimes, this harmony is disrupted, leading to a rhythm that is too fast, too slow, or irregular, a phenomenon we call arrhythmia. Some of you might be thinking, why should I care about arrhythmias? I'm not a doctor. And indeed, while it's true that this topic is particularly significant for healthcare professionals, it's also crucial for everyone else. Why? Because arrhythmias can strike anyone at any age and at any time. They're not exclusive to the elderly or those with pre-existing heart conditions. Understanding arrhythmias can help us become more aware of our heart health, empowering us to recognize potential problems early on and seek help when needed. It can also help us support loved ones who may be dealing with these conditions by understanding what they're going through and how best to help them. Moreover, in an age where information is at our fingertips, we believe it's essential to be informed about our health. And who knows, this knowledge might just serve you well one day, whether it's in a conversation, a trivia game, or even a life-saving situation. So, with that said, we're going to embark on a journey into the world of cardiac arrhythmias. We'll explore what they are, why they occur, how they're diagnosed, and how they're treated. Now that we've set the stage, let's dive deeper into the world of arrhythmias. So, what's the difference between ventricular and supraventricular arrhythmias? Let's imagine the heart as a house, with the atria as the upstairs and the ventricles as the downstairs. Now, supraventricular arrhythmias are like a party that's gotten out of hand upstairs. The atria start beating irregularly or too fast, often due to issues like high blood pressure, heart disease, or excessive caffeine or alcohol. This might cause symptoms like palpitations, fatigue, or shortness of breath. On the other hand, ventricular arrhythmias are like a chaotic scene downstairs. The ventricles, which are responsible for pumping blood out of the heart, start to beat in an uncoordinated or rapid manner. This can be due to scar tissue from a heart attack, heart disease, or certain medications. The symptoms might be similar to supraventricular arrhythmias, but they can also include fainting or even sudden cardiac arrest in severe cases. Now imagine you're a detective and your job is to figure out what's causing the commotion. In the case of supraventricular arrhythmias, you might see a rapid or irregular heartbeat on an electrocardiogram or ECG. For ventricular arrhythmias, the ECG might show a bizarre, wide, complex rhythm. When it comes to calming the chaos, the approach depends on where the party is. For the upstairs commotion, or supraventricular arrhythmias, treatments often include medications, lifestyle changes, or sometimes procedures like cardioversion or ablation. For the downstairs ruckus or ventricular arrhythmias, treatments might involve medications, implantable devices like a defibrillator, or procedures such as ablation. In the end, understanding the difference between these two types of arrhythmias is like knowing whether to send the police upstairs or downstairs. It helps not only in diagnosis but also in determining the most effective treatment method. After all, in the tale of two hearts, it's essential to know where the trouble lies. But how do we know if it's a ventricular or supraventricular arrhythmia? Well, this is where the electrocardiogram, more commonly known as the ECG, comes into play. The ECG is an inestimable tool, tracing the electric signals in the heart to provide a graphical representation of the heart's rhythm. Let's start with ventricular arrhythmias. When the lower chambers of the heart, the ventricles, are the origin of the irregular rhythm, we call it a ventricular arrhythmia. On an ECG, ventricular arrhythmias often present as wide, bizarre QRS complexes. These are the waves that represent the ventricular contraction. Ventricular tachycardia, for instance, shows a rapid succession of these wide QRS complexes, like a frantic Morse code on the ECG. On the other hand, supraventricular arrhythmias originate from the upper chambers of the heart, the atria. These arrhythmias frequently present as narrow QRS complexes on the ECG, reflecting the more rapid conduction of the electric signals. An example of this is atrial fibrillation, where the ECG shows an irregular rhythm with no discernible P waves, the waves that represent atrial contraction. It's as if the heart's rhythm is dancing to its own irregular beat. But of course the ECG is not just about the QRS complexes and P waves. There are other features to consider like the PR interval and the ST segment. And it's crucial to remember that while the ECG can guide us, it's not infallible. It's one piece of the puzzle to be considered alongside the patient's symptoms and clinical history. The beauty of the ECG is that it allows us to visualize the heart's rhythm, to see the unseen. It's a bit like listening to a piece of music and being able to see the sheet music. It provides us with a deeper understanding of the rhythm and helps us to identify any irregularities or discordant notes. Indeed, the ECG is a powerful tool in our arsenal against cardiac arrhythmias. It's through this intricate dance of lines and waves that we can trace the rhythms of the heart and identify the origin of the arrhythmia, guiding our approach to treatment. So we've diagnosed the arrhythmia. What's next? Treatment, of course. And when it comes to treating cardiac arrhythmias, we're fortunate to have a variety of options at our disposal. Let's start with the pharmacological routes, shall we? First off, we have antiarrhythmic medications. These drugs work to restore the heart's normal rhythm and prevent further arrhythmias from happening. They're often the first line of defense, with classes like beta blockers, calcium channel blockers, sodium channel blockers, and potassium channel blockers making the top of the list. Next are anticoagulants, or blood thinners. These aren't used to treat the arrhythmia directly, but they're crucial in preventing blood clots, which could lead to strokes in patients with certain types of arrhythmias, like atrial fibrillation. But what happens when medications aren't enough? That's where non-pharmacological treatments come in. Cardioversion, for instance, uses electric shocks to restore the heart's normal rhythm. This is often used when medication fails to correct an arrhythmia, or when the arrhythmia is causing severe symptoms. Then there's catheter ablation, a procedure where a long, thin tube is inserted into the heart to destroy the abnormal heart tissue causing the arrhythmia. This can be a good option for patients who can't tolerate medication or whose arrhythmias aren't controlled by medication alone. For some, a pacemaker or an implantable cardioverter defibrillator, ICD, may be necessary. These devices are implanted under the skin and use electrical pulses to help control abnormal heart rhythms. And let's not forget lifestyle changes. Regular exercise, a heart-healthy diet, and avoiding triggers like caffeine and alcohol can all play a part in managing cardiac arrhythmias. As with any medical condition, it's crucial to remember that every patient is unique. What works for one person may not work for another. That's why it's so important to work closely with your healthcare provider to develop a treatment plan that's tailored to your needs. Remember, early diagnosis and treatment can save lives. So don't hesitate to seek help if you or a loved one is experiencing symptoms of a cardiac arrhythmia. It's a journey, but with the right treatment, it's one you don't have to walk alone. Let's wrap up with some key points to remember about cardiac arrhythmias. Firstly, we've learned that arrhythmias are not just a simple heart hiccup. They're a serious condition where the heart beats too fast, too slow, or with an irregular rhythm. This can lead to a variety of symptoms, from fatigue and fainting to more serious complications like stroke or heart failure. Secondly, we've delved into the difference between ventricular and supraventricular arrhythmias. Ventricular arrhythmias originate from the lower chambers of the heart, the ventricles. These are often more serious and can lead to sudden cardiac death. On the other hand, supraventricular arrhythmias start in the upper chambers, the atria. While typically less dangerous, they can still cause significant discomfort and complications if left untreated. Thirdly, we've explored the importance of ECG findings in diagnosing these conditions. The electrocardiogram, or ECG, is a crucial tool in identifying the type and severity of an arrhythmia. By tracing the electrical signals in the heart, we can pinpoint where the irregular rhythm is coming from and devise a treatment plan accordingly. Lastly, we've touched on the various treatment options available. From lifestyle changes and medications to procedures like cardioversion or ablation, there's a wide range of strategies to manage and treat these conditions. It's essential that anyone diagnosed with an arrhythmia works closely with their healthcare provider to find the best treatment plan for their situation. So, there you have it. A brief journey into the world of cardiac arrhythmias, understanding these conditions, recognizing their ECG findings, and knowing the available treatment options are key steps in managing and ultimately overcoming these heart rhythm disorders. Remember, a healthy heart is a happy heart. Stay informed, stay healthy.